September, as we welcome to the desk our good friend, Dr. Eugene Cherny. We are talking about some of the mysteries surrounding some things you might see on TV, I think you could say. Is that the safest way to say that?
That's the easiest way to say it. That's right. There's all kinds of crazy things going on, and people are very interested and want to learn more.
And still, it baffles, especially Jason Parkin, the interest that surrounds a certain family on a certain channel.
I don't get it, but we're going to talk about it.
But
I don't get it either.
Why is everybody fascinated with the whole Kardashian and Jenner and?
I can't tell you. We need to have a media expert to really explain that, because they're famous because they're famous.
Right.
And then the way they, maybe it's their lifestyle. Maybe people envy the lifestyle of the rich and famous.
And apparently, if you don't like the lifestyle, you just wait a little bit and then decide you're going to change everything. For example, Bruce, a.k.a., it's Caitlyn, a.k.a. Bruce, isn't it?
The buzz continues because he's really managing his media well, and he was on Ellen earlier, and so he's back in the news again today talking about everything. Well, last week we touched bases on what was done on the face. Now, the typical way it goes if you are transgender is that first you start with a psychiatrist and you get a diagnosis of gender dysphoria. Okay. And that's that psychiatric diagnosis. Now, this was actually controversial for a long time, whether that even existed. And actually, the original psychiatrist who did the work at Johns Hopkins University actually has rejected it before his retirement and said that it was all wrong, doesn't really exist.
Nice.
So it's still controversial, but with that, then typically a trial of hormones is tried to see if that is, because that will change. It's amazing how powerful hormones are in changing your behavior and your perceptions. And you try that first for a while, and then after a certain point after that, the surgery is tried.
So if somebody comes to you and says, I'd like to change my look to make it the opposite sex of what I look like right now. Yes. Do you recommend that they go to a psychologist first and start hormones, or will you start a plastic surgery procedure with them?
No, the plastic surgery procedure comes last, actually, the very last. And actually, Bruce Jenner is not doing it in the classical way. Typically, after you've gone through the psychiatry for a very long time, and you've
you say long time. How long are we talking about?
I think they require at least a couple of years.
Okay.
At least a couple of years. And what I would want to see if I was involved in this type of work is that I would want to see that there actually was a psychological benefit, because that's what the first researcher at Johns Hopkins was concerned about. The benefit wasn't necessarily there from the operation in improving the self-adjustment of the individual.
Right. So that's up for debate, but people are doing this.
I would say so, but people are doing it, yeah.
Yeah, whether you agree with it or not, that's exactly true. What I'm going to say right now, but people are doing it, but you're not seeing it in you personally are not seeing a lot of this. Well,
there actually is quite a large gay community and a large transgender community in Des Moines. I've seen some patients, actually, believe it or not, I don't do it because my malpractice insurance doesn't cover it.
Okay.
So I find that I don't do it. If I have referrals to it, I have an old medical school classmate in suburban Chicago that does a lot of it.
Okay.
And this probably is one of those things that you need to go to somebody who does a lot, because some of the operations are crazy complex.
Now I'm going to ask you the next most logical question. What are we talking price-wise to have something like this done? Because I'm guessing it's not covered on insurance.
Well, this is where a lot of battles are being fought. It is being covered by insurance now. Even Aetna Insurance is covering it. But it's interesting. They don't cover what Bruce Jenner had done. They cover the body work. The facial stuff is considered cosmetic, and that is stuff they have to pay for. Okay. And I was speculating that Bruce's surgery for the face probably cost, I don't know, in the $100,000 range. Okay. But it can be had for much less, and for the longest time. And I would say it's still this way today. A lot of transgender patients, they fly to Thailand where it's inexpensive, and they do medical tourism, and the surgery is done commonly there.
Is that safe?
Philippines. Well, this is the whole new discussion, medical tourism. I have a patient that flew to Costa Rica to have like a combination vacation and plastic surgery. Well, and she ended up having big complications, and I basically had to do it all over again. So she had to pay twice, actually. And so there are some excellent plastic surgeons overseas, but you don't know if you're getting that person.
And you can't follow up if you're back here in Iowa, or it's harder to follow up. Let's put it that way.
If you want to keep on flying back and forth,
I guess.
But who could afford that? It's cheaper. Actually, it was cheaper for her to have me fix it than for her to keep on flying back and forth to Costa Rica.
Sure.
So that's how that was.
All right, so what else did Bruce have done to his body then?
Now, Bruce actually is following a different path. He's just using hormones. He's not having the breast implants, and he's not having the reassignment surgery below the waist. He's not having that, and that's the one that.
Okay.
Well, he just says he's just happy, you know, in like the clothes and like with the face done and stuff, and with the new figure.
And he's probably used to it. Yeah. That's what it is.
Yeah. So what will happen? What happens in the typical pattern is that you'll do what insurance covers, and as you save to do the facial work. And so most people will qualify under insurance over time to have the breast done first, and then the gender reassignment below the waist done. And that's the really complicated operation.
Wow. Didn't realize there was all these different legalities involved with it too.
It's crazy complicated, but yeah, I wouldn't have thought it'd be this popular when I was early in medical school. The funny story is that I actually wasn't trained very much in it in my residency, because my department chairman said, nope, we're not doing it, because a year before, a angry transgender patient came and like shot and murdered his plastic surgeon. And so he said, forget it, we're not doing any of it.
You know, I had read that obviously these are people who aren't happy in the bodies they're in, and they probably have,
right.
And I'm speculating here, but depression and other mental issues. And one article I read about it said that the suicide rate after is actually higher than the suicide rate before the reassignment surgery.
That's certainly possible, because well, plastic surgery is sometimes used. You know, it's not even just in transgender surgery. We try to, you know, find out what people's psychological motivations are for any kind of aesthetic surgery. The classic thing is, you know, your marriage is falling apart, and so you have like breast implants. This is one of the classic scenarios, and we're told to really look out for that, because that will actually. It won't make the marriage better, and then you get more depressed, and then you like make the situation worse, and the patient's like really unhappy. So it makes sense that the suicide rate could be higher, because you think it's going to like be like a magic wand and make everything all right. You kind of think that all of your problems are kind of focused on this, and if that was fixed, everything else would be okay. And so you fix that, and everything else is not okay, and you feel like you're still trapped. You know, you're still trapped in one prison or another. And so it does make sense.
What's an example of a time though when or a surgery or something commonly you do when you do make people feel better? When it's, I mean, we're talking about some grim, dark stuff here.
Yeah.
On the positive note, you can really help people feel good in their skin. And when is it a time for you when you feel really good about, I helped that person?
Well, I feel that way every day, because it's all a matter of good patient selection, the ones who it's really right for. What I do the most is, you know, the Mommy Makeover. For many of us, life.
All right, here we go. That's why I'm taking notes. Okay, go ahead. Mommy Makeover.
You look just fine.
I don't know about that. Okay.
Well, the Mommy Makeover, you know, for many of us, you know, life is great for many of us. For many of us, we feel life is a series of things that we've lost successively. And when you've had multiple children, you lose your figure. And you wish you could have, and you know, it's natural to wish you could have it back. And when I can take someone who has a terrible looking body that they're embarrassed about and return it to where it was before the kids messed it up, they're so happy. And so it's usually when we repair the breasts, we lift them and refill them out, and when we get a waistline back, flat abs back. I mean, these are patients that are crazy happy.
That's what makes them feel good.
All right, good.
There it is.
Okay.
Wonderful. Now, people want to get some information about anything like this. Where do they go?
HeartlandPS.com, or give me a call.